everyone. Welcome for today's webinar session. Today is our second and last session on COVID-19 webinar series initiated by Philippine Carabao Center and Livestock Biotechnology Center. Once again, this is Jahanef Naiga, and I am the moderator for today's session. So yesterday we had Dr. Lailani Gustilo as our resource person. She have discussed the nature of the virus or SARS-CoV-2, as well as the impact of the COVID-19 to human health. For today's session, we will be focusing on the impact of COVID-19 crisis in the livestock sector. So again, I just want to inform everyone that this webinar is being recorded, and while our speaker this morning is on session, you may send your comments and questions in the chat box. At the end of the session, we will be sending a post-assessment webinar form via email and a certificate of participation to all the attendees. So now, allow me to introduce our speaker this morning. Our speaker is a Professor 6 from the College of Veterinary Medicine, Central Luzon State University. She took her bachelor's degree in Gregorio Araneta University Foundation in Manila, Philippines, her master's degree in Central Luzon State University, her PhD in veterinary microbiology at Yamaguchi University, Japan. She was a visiting professor in Meiji University, Chiang Mai, Thailand, and Auburn University, Alabama, USA. She was awarded as Outstanding Veterinarian in the academic year 2007 and an Outstanding Veterinarian in Research year 2017. She was also a recipient of Fulbright Philippine Agriculture Scholarship Program for Advanced Research last 2018 and 2019 while she studied in College of Veterinary Medicine in University of Georgia, USA. Let us welcome and hear from Dr. Jamerlin G. Garcia.
Yeah, good morning. Welcome. Thank you for inviting me in this seminar. I was tasked to deliver some insights on the impact of COVID-19 and animal health production. COVID-19 has indeed placed a big impact in human health. As of July 23, 2020, that was last week before I completed this work, I have read that an update of about 14.8 million covers confirmed cases of COVID cases worldwide. In the Philippines alone, we have 74,390 total cases and 48,136 of which is confirmed positive. Okay? So we are really in for this fight, especially the persons who are in the medical profession, and there's no turning back. We are facing inevitable yet unwanted pandemic. How do we see COVID-19 as animal health practitioners? COVID-19 is reported spread from one person to another through respiratory droplets delivered by coughing, sneezing, and talking. There is a danger of contracting the disease when a person comes in contact with contaminated surfaces and objects, then accidentally touches the eyes, the nose, and the mouth, where pathogen can gain entry into the body system. There are claims that COVID-19 is transmitted through aerosol. Aerosol are minute droplets of fluids that are coughed up or that are projected outside of the body of an infected person, which is carried away by the wind or by the air, then may accidentally lodge on the body surface, respiratory tract or nasal cavity or nostrils or mouth of a susceptible individual. That's how COVID-19 challenge starts its infectivity in the human race. Before going on further, let us tackle a few review. COVID-19, as we all know nowadays, is reportedly discovered by a type of coronavirus which they term as SARS-CoV-2. SARS-CoV-2 is an acronym which means Severe Acute Respiratory Syndrome Coronavirus Type 2. It is recognized as a beta coronavirus and is related to coronaviruses that are found in many populations. Okay? Mga paniki in our common language or vernacular. Well, the causative agent of COVID-19, which we call it as SARS-CoV-2, is related to the causative agent of SARS coronavirus, which was reported in 2002, and the same as that of the causative agent of the MERS-CoV, which was responsible in taking the lives of many human beings in the year 2012. Well, the COVID-19 disease is reported to be presenting with fever, dry cough, fatigue, difficulty in breathing, muscle and joint pain. Veterinarians did not rest. Pandemic went on, or as the pandemic tried to soar up and victimize many susceptible human beings. A report says that researches have been conducted to confirm the possible role of animals in the transmission of COVID-19, because some believe that animals can be involved in the transmission of the disease itself. But there are reports that no, animals are rarely involved in the spread of COVID-19. However, in other reports by other countries, conducted in other countries, it has been demonstrated that the positive detection of SARS-CoV-2 in cats, dogs, and wild animals were possible. So we have varied idea, we have varied information on what really this SARS-CoV is all about. In other countries like China, other studies have conducted to test the vulnerability of domestic animals to coronavirus. And then based on their findings, they were able to find out that cats and dogs are less likely involved in the transmission of the virus within the same species of animals. And in other findings, they said that pigs, ducks, and chickens are not susceptible to SARS-CoV-2. Other tests were undertaken to validate the possible expression of the virus in domestic animals. This time, these animals were obtained from patients confirmed with COVID-19. But still, no proof has been generated by these research findings which can describe an animal to human or an animal to animal transfer of SARS-CoV-2. Let's talk about the impact of SARS-CoV-2 on animal health. With the few findings we have just mentioned a while ago, it appears that human seems to be the main host of SARS-CoV-2 infection. As no research has come out with an information on a human to animal transfer of SARS-CoV has come out, we can infer that SARS-CoV-2 infection may not directly affect human health, particularly food-producing animals. But in this truth lies the challenge for every veterinarian and animal health practitioner, where we should be off guard on the health conditions of our livestock at the verge of this pandemic. The impact of SARS-CoV-2 can be felt in the livestock sector at the local, regional, and even at the national levels. Kung pag-uusapan natin ang Pilipinas lang. We were aware of the massive lockdowns, quarantine measures, travel restrictions, and border control, which all had a negative impact to the livestock sector. Some of these, we can collectively term them or group them as socio-economic impact of the COVID-19 pandemic to the animal production system. It was evident to all of us that during the pandemic, when restrictions, quarantine measures were extensively implemented, we noted labor shortages. In the implementation of labor shortages, we could not get away from the reduction of the capacity of many animal production facilities to reduce or the reduction in their capacity to carry out routinary animal health activities like medical treatment and prophylactic treatment, the worming vaccination. Okay? Another would be, there could be possibility or there were possibilities that sick animals receive treatment in delayed time frames because of varied reasons. And the delay in treatment and the delay in the delivery of treatment in sick animals somehow reduces animal performance. One more is that during the lockdowns and quarantine periods, whether we accept it or not, many veterinary services, veterinary visits that has to be rendered by every veterinarian were all closed or were all reduced because everybody were obliged, were forced to restrict in terms of their movement across and without and inside farms. During the lockdown, we experienced less services in terms of veterinary activities. As we have said a while ago, vets have limited their consultation visits. Thus, maintenance of health programs were a little bit reduced, unlike during the normal periods when there was no pandemic at all. Farms, veterinary heads of animal production facilities have to make changes in the logistics and supplies in the farms because nobody can just get out of the farm and buy the drugs, the vaccines, and disinfectants they need for their usual or routinary operations in the farm. And of course, another thing is that all these things have somewhat increased the expenditures in the farms because it takes an extra amount of money to buy for chemicals and disinfectants, protective clothings, PPEs, just to implement the necessary biosecurity and biosafety measures. During the lockdown and quarantine period, many employees in the farm were requested to temporarily stop from their assignments. Okay, some farm workers became or faced apprehension on the possible effect of COVID-19, and this somehow limited their normal routine work. In other conditions, some farms found difficulty in moving animal products like milk, eggs, and meat that are to be brought to the market. Another is that because of the lockdown, of course, we have felt the capacity to purchase production inputs was not that normal compared to the usual farming conditions before the lockdown. And in addition to these impacts, we also found difficulty to avail of diagnostic services from outside sources. Let us just talk about a few possible impacts SARS-CoV-2 or COVID-19 infection on different areas of the veterinary field. We cannot get away from issues about animal welfare. We are aware that some non-government units are responsible in the provision of animal shelter and rescue operations, especially during periods of calamities. And in spite of their eagerness to carry out their responsibilities to give shelter to these animals, those operations or those activities were somehow suspended during the pandemic. Their responsibility or their commitment in fostering and adopting animals during this period of pandemic were likewise discontinued as an effect of the lockdown. In some countries, some veterinarians do not have the access to resources by which they can take care of these animals, and that the food shortage triggered animals to get abandoned. These were commonly observed in countries like Italy, China, and South Korea. Another thing that that cannot escape our awareness is that our government has a strong program that involves the prevention and control of current transboundary diseases like ASF and avian influenza. But with what happened to our present setup, the onset of the pandemic, the funds set by the government for the prevention and control of current transboundary diseases may be reallocated to reduce the socio-economic impact of COVID-19. And this would later compromise the capacity of the government to carry out the said or the intended programs on transboundary diseases. Again, let's review. There are government-initiated programs that were undertaken and implemented by government stakeholders. And these were intended to reduce the impact of COVID-19 and to ensure the management of animal health and continuity of livestock supply to the entire Filipino people. One includes the temporary ban on the trade of wild animals, because many stakeholders believe that wild animals can serve as carriers of all these transboundary diseases or even this pandemic. Another is that there has been intensified programs that were implemented in order to intensify animal disease control and eradication. Another is that enhancement and effort of many stakeholders in monitoring and prevention of epizootic related diseases in animals. Another is that there has been an active surveillance of other coronavirus infection in pets like dogs and cats that had exposure to COVID-19 infected persons. And the last but not the least is that there are government programs intended to raise public awareness on the no evidence of COVID-19 spread from companion animals to humans. So, though there are no cases of COVID-19 in animals compared to humans, every animal health professional has a role to play in order to maintain the standards of animal production, while upholding the commitment of the national government to provide food for the people during the pandemic and to reduce chances of every constituent to get exposed to infection. So maybe we can summarize these different responsibilities of animal health professionals. We have seen that in all farms, in all animal producing facilities, we can see everybody wearing protective personal equipments, PPEs. We are advised to carry with us alcohol-based sanitizers and disinfectants. We were advised to install foot baths and dips in the vicinity of the farms. There is a restriction for veterinarians to undertake farm visits, especially if they are infected with COVID-19. And physical distancing was strongly reinforced in the farms. These are all undertaken in attempts of the veterinarians to spearhead in the implementation of biosecurity and biosafety measures within their areas of assignments. Veterinarians do assist in animal disease prevention and control. Even during the lockdowns, head of animal production facilities did their best to provide a channel for open communication with farm workers so that this would encourage continuous reporting of diseases and animal deaths of unknown reason. Veterinarians who work in production facilities have sustained inventory of medicines, disinfectant supplies, and equipment with the hope that they can provide the needed inputs in cases of infections in the animal stocks, even during the lockdown. Assistance is also given by animal health professionals in planning contingency measures in the livestock production facility. This include identification of an available veterinary drug supplier and provider of other professional services such as medical representatives who have the ability to deliver drugs or medical supplies, feeds, on the due date expected. And we have seen how essential consumables in the stocks of syringes and tubes and many other medical kits in the farms are maintained and sustained because of the assistance of the animal health workers. However, there were also some challenges that has to be faced by animal health professionals, such as things that would require them to make adjustments, like feed shortage. We have seen them resort to the utilization of farm resources like feeds, roughages, and silages were mobilized to be produced in attempt to augment the limited supply or the decreasing amount of commercial feeds for animal production. Another challenge that face animal health practitioners is the role to identify most relevant priorities and functions which have to be performed with a minimum number of personnel. So they have to make adjustments in such a way that they can plan as to who should take care of this operation, of this of the feeding of the animals at a time when there are no animals expected to deliver on this date. So we can ask these people to fit in while there is no open job or open activity for them for this particular period of time. So those are the different adjustments that animal health professionals have to face. So animal health professionals are not the only persons who felt the brunt of this pandemic. Other animal health workers and other stakeholders have a role to play during this pandemic in order to provide a safe, quality product that would foster food security and food safety for the Filipino people in this trying time of pandemic. So here are the challenges faced by animal health workers and other stakeholders. So personnel in animal production systems were mobilized in attempt to restrict the entry of outsiders in the livestock production facility. They were asked to install footbaths and perform frequent disinfection. Rigid practices and hand washing, taking of temperatures were strictly monitored in every farm during the pandemic. Some adjustments were also made to fit in with the demands of biosecurity and biosafety during the pandemic. In some farms, we have seen that they staggered the arrival of workers, staggering in such a way that only this person will be allowed to enter at this time, then they will be allowed to get out before another batch of persons would come in an attempt to reduce making groups, that's what I should say. Another is that people in the farms were asked to perform social distancing. People in the farms were also asked to create designated areas for external visitors, designated areas for sleeping quarters, and resting areas. There are farms wherein before the entry of somebody, they were subjected to body temperature screening. In other farms, programs like putting barriers, not only in the offices, but even in small stock rooms were placed in order to comply with these adjustments. In other farms, meal times were also staggered to avoid large gatherings. Other programs observed and implemented in the farms was to make adjustment, make contingency plan to identify substitute persons to take care of the animals when one or two or some caretakers cannot fit in for the day. This is to prepare for the possible shortage of workforce. But veterinarians, animal health practitioners, animal health workers, and all other stakeholders in animal production facilities did not simply rest, but rather they made efforts to continue sanitary programs and all basic programs to maintain health to ensure health in animal health production system. They did not fail in their commitments to undertake routinary vaccination procedures, the worming vector, as well as rodent control. We can see how the medical team were alarmed and how they responded to the challenges brought in by the COVID-19 caused by the SARS-CoV-2 virus pandemic for the past 5 to 6 months. Although veterinarians and other animal health professionals have no direct involvement on the management of COVID-19, the commitment to carry out responsible management of animal health production has never been set aside. In trying times like this, it is the role of the livestock sector where we veterinarians and other animal health workers to provide a continuous supply of safe and wholesome food derived from healthy animals. Thank you very much.
Thank you very much, Doc Jem. Now, we will proceed to the Q&A. Doc Jem will be entertaining questions from the audience. Okay, we have a question here. As of the moment, is it recommended to get my pet for COVID-19 even if there is no concrete report of animal to human and animal to animal transmission?
Which are you going to test? Is it animal or human?
The animal po.
Oh, okay, that's it. So is it possible to test animals for COVID even if there is no transmission from human to animal? That's your question, right?
Yes.
Okay. What's the use of testing an animal for COVID-19 when, or especially when we know very well that coronavirus infection is not transmitted from human to animals. And number two, we have to see the clinical signs first, which I think we may not see it. The fatigue, the signs we have just mentioned all about a while ago may not be seen in animals if in case they show or if in case they are infected with COVID-19, unlike what human beings manifest. I think it's not practical to let an animal be tested to COVID-19 unless there are no clinical signs of the disease, which I guess it may not be manifesting in animals. Actually, this is indeed a challenge for all of us because many say that only human beings are infected with COVID. And some say that it may not be transmitted to animals. But who knows? Things can happen. Everything can happen under the heat of the sun unless there is a substantial result of research that would tell us that definitely COVID-19 from a COVID patient is SARS-CoV pathogen from a COVID patient has been isolated from an animal which lives closely to the patient, unless we cannot substantially prove that link or chain. I think we cannot really claim that there is a COVID transmission between human to animal. And maybe we will look forward for research, to give us the chance so that we can explore, we can unravel the real truth behind this belief or theory.
We have another question po. There is no evidence that companion animals are playing an epidemiological role in the spread of human infections with SARS-CoV-2. However, reports from infected minks farms suggest that in these environments, there is the possibility for transmission of SARS-CoV-2 from mink to humans following infection of these animals. What precautionary measures should be taken when companion or other animals have close contact with humans suspected or confirmed to be infected with SARS-CoV-2?
Yeah. Okay, that's a nice suggestion. Uh, Probably this could be a this should be considered by countries like the United States or maybe Europe, wherein minks, how do you call this, wildlife, primates are seen everywhere, right? But as what I have told you, if they suspect that these minks or small animals may play a role in the transmission of COVID-19 or the pathogen that causes COVID-19, then they should implement a strong rodent or vector control. I think that has to be spearheaded by governments around the world to stop and prevent the transmission of the disease from animal source to human as recipients of infection.
Okay po. Thank you po for that. Hello. So
Yes.
I think we don't have any more questions na po, Doc.
Okay.
So, so at this moment, we would like to give the award of certificate of appreciation.
Okay. Thank you very much. Thank you very much.
So allow me to read the citation. Philippine Carbo Center and Livestock Biotechnology Center presents this Certificate of Appreciation to Dr. Jamerlin G. Garcia for the time and expertise as a resource speaker during the Livestock Biotechnology Center webinar series, COVID-19 Health and Socioeconomic Impacts on the Livestock Industry on July 28, 29, 2020. Signed, Dr. Clara N. Mingala, Chief of Livestock Biotechnology Center, and Dr. Eufrosina Piatabay, OIC Chief of Research and Development Division in the Philippine Carabao Center.
Thank you. Thank you very much.
Thank you po. The same certificate will be also awarded to Dr. Lailani Gustilo. Okay, in behalf of the Livestock Biotechnology Center, I would like to thank everyone for attending this webinar on COVID-19. Thank you very much for making the time to join us this morning. And I think that ends our session this morning. And may we request everyone to please turn on their camera so we can take screenshots for photo documentation.